15-month-old Jackton Opana is coughing, vomiting with high fever, and has had severe diarrhea for 2 days. In this part of Homa Bay County, Western Kenya, access to health facilities is limited, and a child is more likely to die of preventable diseases such as pneumonia, malaria, and diarrhea before his or her 5th birthday than anywhere else in Kenya.
Before, nilikuwa ninampeleka hospitali hapa Nyagoro. Ni mbali. Ukienda unapanda motorbike. Ukikawia, ukitembea na mguu, mtoto anaweza umia.
Jane is one of the many community health volunteers who have been trained and given medical kits to treat children in their homes or to refer them to a health facility. This is part of the new Community Health Initiative, Integrated Community Case Management Program, or ICCM, which is supported by UNICEF in partnership with the Homa Bay County Government and the Kenya Medical Research Institute, or KEMRI, to save children's lives at household level.
In my community, they never knew anything about going to hospital, or they never knew anything about health. So by the time I was trained, I was taken to a training, I had to come back and talk to them. So they call us and we treat the child at home. If there's no change, is when we can refer, or if there's any danger sign, is when we can refer to the facility.
When she is satisfied with her findings, she sends a text message to the KEMRI hotline attendant, who calls back to confirm the diagnosis. After a lengthy discussion, the KEMRI hotline attendant gives Jane the green light to proceed with the treatment. To manage the diarrhea, she first gives oral rehydration solution, then amoxicillin, an antibiotic to treat pneumonia. She also checks for signs of malnutrition, and the last time Jackton received vaccination and vitamin A supplements. Jane will return after 3 days to check on his progress. Under the ICCM program, when a community health worker treats a pneumonia case, a quality assurance nurse is sent to the home of the sick child for physical confirmation within 24 hours.
The whole point of ICCM is not to drain or to take away healthcare from the facilities, but I think it's to also sort of like task shift and allow the nurses to focus on the children who really, really need their care, and not the ones who are, you're stuck with this queue of 70 babies and they all 65 have diarrhea and the 5 who are in the queue who've got pneumonia are dying, So if all these 65 can be seen, in the community, then you're left with these 5 who are really sick and who the nurse can actually focus on.
To date, about 2,604 community health volunteers and 251 community health extension workers and supervisors have been trained and are spread across the 5 sub-counties of Homa Bay County. The training focused on health skills relevant to diagnosis and classification of illnesses among children. Wherever they work, these community health volunteers are linked to a health facility where they receive support and get to refill their medical kits. In Nyagoro Health Center, for example, 10 community health volunteers are linked to the facility.
Every month, the community health volunteers come to the facility, they meet, and we have a discussion together. So we compare and we check their reports. So we discuss with them. If we meet gaps, we train them more on what to do.
Homa Bay County is the first in Kenya to adopt this innovative and highly cost-effective approach to bringing health care and quality health information closer to children and women. The county government welcomes this health strategy as a way of addressing the crisis in the area, which has the highest rate of under 5 mortality in Kenya and the second highest rate of maternal and infant deaths.
These are preventable diseases. The time is of the essence here. Let's, for example, diarrhea. Most kids die because of dehydration. If that child can be fluided up in time, you save life, you know. So, and unfortunately, even in our referral hospital, many people are dying because there was that delay. If we can intervene in time and effectively, and I think that is where ICCM is playing the greatest role, lives should not be lost.
Combating preventable diseases is largely a household and community effort. Through this community initiative, UNICEF, with funding from the Government of Canada, is supporting Homer Bay County to prevent children dying from pneumonia, malaria and diarrhea. Indeed, the Government of Kenya has signed the A Promise Renewed pledge, which holds leaders to account in accelerating the reduction of preventable maternal, newborn and child deaths. All children deserve a fair chance. This is Edita Nsubuga reporting for UNICEF Television. For more information, go to www.unicef.org.